I am 25 and I have adenomyosis. What can I do? This is a challenging question and the right approach depends on a few factors. Let me guide you through it. Step 1. Confirming the diagnosis. How was your adenomyosis diagnosed? If it was through an ultrasound, it might be a good idea to get an MRI for confirmation. Even with an MRI, it is not always possible to be 100% sure that you have adenomyosis, but it can give us more clarity. Step 2. Do you have symptoms? The next question is whether you have symptoms. The most common symptoms are heavy menstrual bleeding and severe menstrual pain. If you don't have symptoms. If the adenomyosis is small and you're not experiencing any symptoms, the best approach is regular monitoring. An ultrasound can help track the size of your uterus. To be more precise, we recommend measuring the volume of your uterus, not just its length, width, and height. If you have symptoms. If you are experiencing symptoms, treatment becomes important. The main goal of treatment is to reduce or stop your menstrual bleeding. This is because bleeding during your period can cause the adenomyosis to swell and grow further. By reducing or stopping menstruation, you can slow down its progression. Step 3. Treatment options. Now let's talk about treatment options. Most of them involve hormones, so it's important to weigh the benefits against the potential side effects. Hormonal treatments. Number 1. The Mirena intrauterine device, IUD. This is often the best option. It releases hormones locally in the uterus, so very little enters your bloodstream. That means fewer side effects. Number 2. Continuous oral contraceptives or Dinoges. This can help reduce bleeding and ease symptoms. Number 3. Depo-Provera injections. These are given every 3 months and can stop your periods entirely when medications don't work. If hormonal treatments aren't effective and the adenomyosis keeps growing, you have 2 additional options. Number 1. Adenomyomectomy. This is a surgery to remove the adenomyosis tissue from your uterus. Number 2. HIFU, high-intensity focused ultrasound, a non-invasive option that uses ultrasound energy to destroy the adenomyosis. Both options have their pros and cons, and I'll cover them in more detail in another video. Final thoughts. Managing adenomyosis can be tricky, especially at a young age. The best treatment depends on your symptoms, the size of your adenomyosis, and whether you plan to have children in the future. I recommend speaking to a gynecologist who have experience with adenomyosis to find you the right approach for you. Thanks for watching and feel free to leave your questions in the comments.